Good evening and welcome to our first in the series of Advocacy Day webinars on the Illinois PTA legislative priorities. I'm Brian Minsker, President-elect for the Illinois PTA, and with me tonight is Lisa Garbati, our Legislative Advocacy Director. Say hello, Lisa.
Hi, everyone. Thank you, Brian.
All right. I'm going to turn over the first part to Lisa right now and let her get started.
Thank you. Well, we're going to begin with how our advocacy priorities are determined. First, let's talk about resolutions. Resolutions are one of the primary drivers of legislative and advocacy priorities. A resolution can be brought forward by any local PTA unit or council, and this would be based on a statewide issue or concern on which they want the Illinois PTA to take action. The issues are membership-driven, and they're voted upon by delegates at the Illinois PTA convention each year. You can find information on current and past resolutions at the Illinois PTA website. Just go to the Advocacy tab and click and look for the term resolutions on the left-hand side of the page. Here you'll see information on the details of each resolution, ways that your membership can support them, and how your local unit or council can prepare its own resolution. We also have new information provided every year in the local unit packet. With these, you can address issues with your local PTA and provide the means for resolving those issues to each and every member. So currently we have 2 active resolutions. The Special Education Issues Awareness Resolution of 2014 focuses on the increased awareness of special education issues. With directives that were set for us by our membership, the Illinois PTA provides important information every year in the immediate use section in the local unit packets and through blog posts and for consideration of related legislation. The most recent resolution is for young adults involved in the justice system from 2016. With this resolution, we've been directed to create a committee to study the issue of treatment of young adults aged 18 to 21 in the justice system and whether, based on the research surrounding brain development and other factors, whether they should be included in the juvenile justice system or in another category separate for adults or remain in the adult category based on the research. We'll be presenting a committee report in 2017 convention. So some of the past resolutions that we have would be the energy drinks resolution from 2013. Based on that resolution, we supported a bill that banned the sale of powdered caffeine to minors. That bill is now law. Based on our continuing positions, we continue to support legislation that would ban the sale of energy drinks to minors. Resolution on the choking game was also membership-driven, and through the actions directed by this resolution, we successfully worked with the Illinois PTA Academy of Pediatrics, the Illinois Academy of Pediatrics, to provide information to pediatricians and parents on this safety and health concern. Now that this is a continuing position, we'll be working to provide appropriate information in the schools. Another important resolution is the one on food allergy from 2008. Childhood allergies continue to be a growing concern. With the directives provided in this continuing position, we have supported a number of related bills on emergency epinephrine auto-injectors and on the requirement for asthma action plans. Two bills became laws this summer in part because of our support in relation to this area. Juvenile justice has also been an important area where we have advocated for children. PTA advocacy was instrumental in creating the juvenile justice system, and both our state PTA and national PTA continue to advocate for children involved in the justice system. Bills supported by the Illinois PTA this past session have become law, including providing lawyers for children under 15 for certain felony offenses, the reporting of critical incidents to minors in custody, and expunging juvenile records after age 18. Each and every one of these priorities has been a result of directives provided by our membership. The Illinois PTA legislative platform is also directing our priorities. This platform has been created over time by our membership. Our membership votes a convention, and that's when we may or may not decide to change this platform. One of the most recent updates during this 2016 PTA convention was the platform item related to school funding. It's been amended to include the requirement that we advocate for sustainable funding in addition to the previously existing language that school funding should be equitable. Next slide, please. The legislative platform can also be found on the Illinois PTA website under the Advocacy tab. Under this section, you can page through each platform item and review the explanations for each one. We also have on our Illinois PTA Take Action section a number of things that you can advocate or use to advocate with your membership. This is where we put the information and the directives into action and provide this to you. Now, each year we have as many as 10,000 bills that are introduced in the General Assembly. Naturally, we can't reach out to every one of our members on each and every bill that impacts children and still address those bills in a timely fashion. That's why we maintain the membership-driven legislative platform. This way we can view each bill through the lens of the legislative platform to see if the Illinois PTA should support, oppose, or just monitor the bill. In the Take Action section of our website, you can find information on current legislative campaigns, our positions on legislation, and see how your legislator voted on this legislation through the posted scorecard. Brian, would you like to continue with national priorities?
Certainly. As a constituent association of the National PTA, the Illinois PTA also draws its legislative priorities from those of the National PTA. You can find National PTA's federal policy agenda on their website at pta.org under the Advocacy tab. This agenda provides information on National PTA's advocacy positions on topics such as early learning, special education, technology and student data privacy, and post-secondary access opportunities, as well as some of the topics that we'll be talking about that are our priorities here tonight. Finally, there are topics that arise in a short order that the Illinois needs to address and are considered sort of hot topics that also define our priorities. For example, no one could have anticipated that the Illinois PTA would need to advocate that the General Assembly and Governor pass a state budget, since they had done so for over 100 years with no problem. But that is the situation we found ourselves in last year and why we have been advocating for the passage of a full budget that's funded. Another topic that has become a hot topic is the lead crisis. Flint, Michigan's water crisis highlighted the well-known public dangers of lead in drinking water, and recent testing in water at the Chicago Public Schools has also brought the topic to the forefront here in Illinois. So those are some of the things that we use to determine what our priorities are. Now let's look at some of our specific priorities. The first topic we're going to talk about is school funding. And while the stopgap budget measure passed this summer has funded K-12 education for the year, Illinois school funding by the state is still among the lowest in the country. These 3 points here on the budget are part of Illinois' advocacy towards passing a full budget for the year. First, revenue must be increased. The do-nothing budget that we had in 2015 that was done only through court orders and other contractual requirements that the state had to do was spending more money than the state brought in by about $4 billion. And so it's clear that if we are going to fund social services, higher education, and actual state government operations, that we need more revenue. Second, not passing a budget is still making a choice. It's a choice to cut funding for social services, higher education, and other budget items without any public input or debate. And third, education is an investment in Illinois, not a cost. A professor from the University of Illinois at Urbana-Champaign calculated the return on investment for education spending in Illinois, looking at direct costs and benefits only. K-12 education had a 9.5% return on investment, while community college spending had a 12.9% return, and four-year college and university spending at places like the University of Illinois at Urbana-Champaign, U of I in Chicago, Chicago State, Eastern Illinois, Western Illinois, and the other public universities here in the state had a 12.3% return on investment. For comparison, over that same time period, the Standard & Poor's 500 stock index only had a 7.2% return on investment. What this means is that every dollar that Illinois spends on education pays for itself in 2.3 years in budget savings alone. The other school funding topic that we are advocating on as a priority is school funding equity. The Illinois PTA platform calls for funding that is adequate, equitable, and sustainable. And we need to make sure that there is adequate funding for every student and every school district in the state. However, the Illinois PTA does not support any funding formula that creates losing school districts, and that hold harmless clauses that are supposed to protect school district budgets from losing money from the state should not be just for a single year, but going far forward from that. Our second priority topic is family engagement. The Every Student Succeeds Act, passed by Congress in December of last year, created the state family engagement centers. However, Congress has failed to fund them in the past year with their budget allocations. Illinois PTA has cooperated with National PTA to lobby for these, or advocate for these centers to be funded. In addition, the Every Student Succeeds Act, or ESSA, has parent engagement and advisory roles throughout on many of the standards that Illinois will have to set under the law. Illinois PTA has representatives on many of these advisory committees helping to shape the plan, and meaningful family engagement is encouraged by the Illinois PTA both in formulating and in implementing the plan. The Illinois State Board of Education has created the Illinois Family Engagement Framework to help school districts to engage families. These are based largely on the National PTA standards for family school partnerships that have been in place for over a decade, and that National PTA has implemented through the School of Excellence program. Illinois PTA had 2 schools named National PTA Schools of Excellence last year, and the sign-up date to join this year's School of Excellence program is October 1st. Our third priority area is childhood health and safety, and the first part of that is in funding. Cuts to the Illinois budget, or lack of the passage of a budget, has resulted in cuts and closures in many services, social services, for children. Professional staff have been laid off from these services and have likely found other jobs, meaning that should state funding come back, these services may not be able to staff themselves to provide services for students in the future. Some of the services that have been cut include teen pregnancy prevention programs, the autism program, which was a nationally recognized network of autism-related service providers throughout the state to help children, 1 in 68 of whom are estimated to suffer from or have autism. And the substance abuse and prevention programs have been cut. And finally, child care assistance for working people has been cut in terms of the maximum income that one could earn in order to get child care assistance funding. The cut has been, the income level was reduced to a level less than a minimum wage job working 20 hours a week. So if you were working a part-time minimum wage job, you were unable to qualify for child care assistance because you were making too much funding. Lisa will talk now about our other health and safety priorities.
These are just going to be a couple. Certainly energy drinks has been on our radar for a while. Highly caffeinated energy drinks pose a health risk for all children, but their sale to youths under 18 just continues to be unregulated in Illinois. This is despite incidents of seizures, mania, and even death. We supported a related bill that banned the sale of powdered caffeine to minors. That bill became law last year. Based on the directives of our continuing position from our 2013 resolution, we're going to continue to support the energy drink ban to minors in current legislation, although we do have that particular bill installed in the House. More recently in the news, as Brian mentioned, is the health concern of lead in drinking water. The situation in Flint, Michigan has called attention to the issue of the dangers of lead, again, this time in public waters. The ingestion of lead can lead to behavioral problems, learning disabilities, developmental delays, and other health issues in children. As a result, we've seen some additional testing around Illinois. Chicago Public Schools, as Brian mentioned, recently tested the drinking water, and there's concern because they have found some schools with lead in the water. Additionally, and this is in another neighboring state, Indiana, the West Calumet complex in East Chicago found contaminated soil with lead levels up to 66 times the legal limit, as well as arsenic, a known poison, up to 55 times above the limit tolerated for that substance. Currently, we're supporting Illinois Senate Bill 550. This bill concerns and advocates for lead testing of the water in public schools and all schools around Illinois, and if lead is found, it will provide for the correction of that lead hazard. We're continuing to monitor this issue and evaluate bills that intend to address this health concern. Brian, did you want to talk a bit about Teen Reach?
Yes, moving on here. Our fourth priority area is in juvenile justice, and as Lisa mentioned earlier, we have been working based on resolutions for many years on this topic. Not surprisingly, funding of services and the lack of a state budget has caused issues here in juvenile justice area as well. The Teen Reach is an after-school program, and those have been cut, resulting in over 14,000 students with no after-school activities, allowing them more time to get into trouble, as many of them do. The second major cut in juvenile justice area that the budget has affected is the Redeploy Illinois program. This is a diversion program for nonviolent youth offenders, and the lack of funding has closed programs in 23 Illinois counties. Last year, these county programs served 275 youth at a cost of $1.6 million. The cost to incarcerate 275 youth in Illinois would be $30.5 million. So programs such as Redeploy Illinois save the state money. However, because we don't have a state budget, we are not able to fund and save that money. We instead have to send students youth into the juvenile justice system, many of whom end up being incarcerated at a much higher cost. Lisa, you want to talk about our latest resolution?
Absolutely. So I mentioned a little bit about this earlier. The resolution on young adults involved in the justice system called for the creation of a study committee to look at youths aged 18 to 21 in the justice system and determine if they should be treated differently in light of the recent research. This includes research which shows that the brain does not complete its development until about age 25. This includes an important area of the brain, the frontal cortex, that's responsible for risk assessment. This means the part of the brain that says, don't think I should be doing that. It's not developed yet. They don't understand risk. This is based on these studies. We know that. So the committee that's been assigned will be looking at what other states and countries are doing with respect to young adult offenders, and then provide a report, probably recommendations in connection with this research at the 2017 Illinois PTA convention. Once we have that report, the Illinois PTA may take further action in this area based on the results of the report. These are just a few of the areas where we're currently advocating and what our priorities are. Brian?
Yes, and that brings us to the end of our presentation area on our legislative priorities, and we're going to open the floor for questions. We have pictures here of myself and Lisa, so that should you join us at our Advocacy Day in Springfield that we'll talk about in just a second, you'll have some faces that you know to look for. So are there any questions? Hearing none, we'd like to remind you, join us for our Illinois PTA Advocacy Day in Springfield on Tuesday, November 15th, 2016. From 9:30 a.m. to 2 p.m. we will have a table in the rotunda there for you to find us, and we will be there all day. We will have, for those of you who are pre-registered through illinoispta.org, we will have free business cards for you to give to legislators, as well as talking points and experienced advocates who you can follow along with to go and see how they advocate with legislators. And they will also be able to accompany you to your meeting with a legislator. And our next webinar in this series is in 2 weeks on Thursday, October 13th at 7:30 p.m. and the topic will be, quite appropriately, meeting with legislators. Thank you for joining us tonight, and we hope to talk to you in 2 weeks with our Meeting with Legislators webinar, and see you in Springfield on November 15th.